The World Health Organization states that more than 15 million Nigerians, with about 5 to 10% of children, suffer from asthma, and this number is set to increase to over 100 million by the year 2025. Here in Nigeria, the Achieving Control of Asthma in Children in Africa project and Children Air Pollution Profile conducted a study in Lagos which detects that more than 10,000 students between the age of 12 to 14 and in 40 secondary schools in Lagos State has asthma symptoms. To deliberate and provide solution is why this public engagement forum is organized.
We need to have the right attitude to know that it's not a death sentence. It can be treated and patients, they can grow well. Because if somebody is unwell, if you cannot participate in what happens around you, you begin to have inferiority complex. So they have, you're afraid of stigma. They're afraid of all of these things. How can we help these children in school? How can we help identify them? How can we assist them to access care? In case they get into trouble in school with their sickness coming on them, what do we do? How do we encourage the parents to live up to the responsibility of declaring their health status? How do we get their confidence?
The recommendations that have been given as to using peak flow meters and using simple questionnaires to detect asthma at an early stage is very useful, and we hope that that will also help control asthma in schools. The other aspect of looking at what is triggering asthma in the schools is also very helpful.
Permanent Secretary, Lagos State Ministry of Health, Dr. Olusegun Ogboye, says the findings will be considered during policy formulation.
We have listened to the recommendations. There's a team here from our Directorate of Disease Control. We also have a Directorate of Family Health that deals with school health. So we're going to sit down with them and we're going to come up with our own actions to mitigate these things that they've said. We want to improve the detection rate of asthma amongst our students in our schools, and then we want to ensure that treatment is available for them even in school, and that at least someone in the school knows what to do when someone with asthma has an event.
The general public were advised to imbibe the culture of regular medical check, including protection of the environment, as air pollution experts say it can also trigger asthma symptoms and attack. Expectations are deliberations agreed will help reduce the high rate of children with asthma. Aminat Ilegushi, LTV News.